Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Dr. Marina Akhtar. My topic of presentation is humidity and air velocity. I am presented this topic under the kind supervision of my professor Dr. Saira Afzal. Hadith of the day, Abu Huraira Raziallah Anhu reported, the messenger of Allah sallallahu alaihi wasallam said, he who believes in Allah and the last day, let him be hospitable to his guest, and he who believes in Allah and the last day, let him maintain good the ties of the blood relationship, and he who believes in Allah and the last day must speak good or remain silent. Learning outlines: introduction of humidity, type of humidity, effects of humidity, measurement of humidity, introduction of dew point, introduction of air velocity, instrument used to measure air velocity, recent updates, and MCQs. Learning outcomes. At the end of this presentation, participants will be able to describe humidity, its types, health hazards with increase and decrease in humidity, the effects of humidity in the spread of COVID-19, its preventive measures, instrument used to monitor humidity, and air velocity and its monitoring. Humidity. A measure of the amount of water in the air is called humidity. Water is added to the air by the process of evaporation. Humidity indicates the likelihood of precipitations, dew, or fog. Humidity is as well as relative humidity measured in percentage, the amount of water that is actually in the air measured in gram per meter cube. Types of humidity: absolute humidity, relative humidity, and specific humidity. Absolute humidity. Absolute humidity expressed at grams of water vapors per cubic meter volume of air is the mass of water in air. And here is formula shown. Relative humidity is the amount of water in the air compared to the amount of water the air could possibly hold. Humidity values are usually given in relative humidity. Examples: if air is holding half of the water of it could hold, its relative humidity is 50%. If the air is holding no water, relative humidity is 0%. If holding a quarter or 1/4 of the water, it could hold 25%. And further explanation is, it tells how close the air is to be saturated. The relative humidity is the ratio of amount of water vapors actually in the air to the maximum amount of water vapors required for the saturation at the particular temperature and pressure. Factors that affect the relative humidity: amount of water. If you increase the amount of water in the air by adding it due to evaporation, relative humidity will go up. Temperature. Since the warm air can hold more water than the cold air, if you raise the temperature, the relative humidity will go up even if you don't add more water. Saturation. If air is holding all the water it can hold, it is saturated and relative humidity is 100%. Dew point. Dew point is the temperature at which condensation will occur. The dew point is the temperature the air must be in order to be saturated. It represents the temperature to which air would have to be cold with no change in pressure and moisture content for saturation to occur. The dew point is determined with respect to the flat surface of water. If dew point is determined with respect to flat surface of ice, it is called frost point. High dew point indicate high water vapor content. Low dew point indicate low water vapor content. This is showing the relation between the temperature and the dew point. With the rise in temperature, dew points will increase. Factor which affect the humidity: Vegetation. In the area of vegetation, relative humidity is high, whereas in the bare land, there is less moisture, and relative humidity is also less. Altitude. The negative humidity increase as the altitude increases because as we go higher, there is decrease in temperature. Orographic effects. At the higher elevation than 800 meter, relative humidity is less compared to the sea level. Transfer of humidity. The average maximum diurnal relative humidity occur in early morning and minimum diurnal humidity occur in the early afternoon. Two important humidity factors are evaporation and condensation. Measurements. Commonly used instruments are sling, psychrometer, Assmann psychrometer, dry and wet bulb hygrometer. Relative humidity is measured by using a psychrometer. A psychrometer is made of two thermometers. One is covered with a wet cloth. When the air moves over the wet cloth, evaporation occurs and lower the temperature on that thermometer. If you compare the temperature on the two thermometers, you can get the relative humidity. Sling psychrometer is often used to determine the relative humidity. Consists of two thermometer, wet bulb and dry bulb. The difference between the dry and wet bulb reading will give the aid of psychrometric table, the dew point, temperature and the relative humidity. Assmann psychrometer. The aspirator psychrometer by Assmann serves for the measuring air temperature and humidity. Two parallel mounted equal thermometer with colored petroleum are used. The bulb of one thermometer, wet bulb thermometer, is covered by a wick which must be moisture for the measurement. And then dry and wet bulb hygrometer. The wet and dry bulb thermometer is also a hygrometer, which is instrument used to measure the relative humidity of atmosphere. It consists of two thermometers, one with a bulb that is kept dry and one that kept moist. If the reading in the both thermometers are same, it means the atmosphere is 100% saturated, which never occur in reality. For accurate reading, wet bulb thermometer should pass with air should pass with the speed of about 800 feet per minute or 5 meter per second. And here and this table show the effects of low relative humidity or absolute humidity or specific humidity. Absolute or specific humidities are almost similar. Comfort. With low relative humidity, there is dryness of skin, thermal comfort, eye irritation, and health effects. Bacteria, viruses, influenza, pneumonia, asthma, and other microbes, microbials, mites, these all have effects on decrease in humidity. IEQ, ozone generation, particulate level, particulate generation, and bioaerosols. Population, the most affected population, adolescent 3 to 18 years. And low humidity with normal humidity comparison. Effects of microbes or chest infection. Respiratory immune system defense are impaired if the in dry indoor air 0 to 40% relative humidity. Respiratory immune system defenses are impaired, allowing the viruses to infect us more easily. While in ideal indoor air 40 to 60% relative humidity, respiratory immune system defense function effectively, capturing, removing, and fighting germs. And with low humidity, airborne droplets containing viruses shrink by evaporation, are lighter and float for longer. And airborne droplets containing viruses dry, allowing the viruses to survive for the longer. While in ideal conditions, airborne droplets containing viruses retain moisture, are heavier, and fall out of the air. And again, airborne droplets containing viruses retain moisture and allowing physiochemical reactions to deactivate the viruses. Humidity effects and its prevention. In low humidity, especially in winters, effects on skin, dryness, cracks, bleeding from lips, And its preventive measures are: we should increase over water intake, use lotion, cold creams, lip balms, and chapsticks. On respiratory system, effect of low humidity is dryness of respiratory passages, promote RTIs, respiratory tract infections, cause itchy throat. Prevention, use of nasal spray and steam. On eyes, dryness of eyes, itching, burning sensation, and it can be prevented by use of artificial tears and eye drops. And this table showing the health effects of high and low humidity. If the humidity levels are too high, we run the risk of growing molds and bacteria, stuffy conditions, and overall discomfort. Even it causes difficulty in breathing in high humid environment. If humidity levels are too low, we run the risk of catching a cold or infection, dry and itchy skin, damaging your house's woods, siding, or paints. And these are the effects of humidity, high humidity effects, and its preventive measures. High humidity, for example, in summer, it causes dehydration. High humidity and high temperature cause profuse sweating and dehydration that cause feeling of weakness, tiredness, headache, overheating. In the high humidity, natural cooling system of the body is unable to function properly. Sweat from the body did not evaporate. This cause rise in body temperature and cause heat stroke, syncope, even cause death. And also in high humid areas, environment, worsening of asthma. High humidity cause difficulty in breathing in asthmatic patient. Humidity also make the air stagnant and enough to trap pollutants, allergens like pollen, dust, mold, dust mites, and smoke. These can trigger the asthma. Preventions: in case of dehydration and overheating, one should increase water intake, wear light loose garments, and stay in shady areas, take frequent showers. And asthmatic patients should use inhalers and dehumidifier. Air velocity. My next topic is air velocity. Velocities are measured in meter per second. When the wind speed is 0.5 meter per second, it is described as a complete calm with smoke rising vertically. When it is 3.3 meter per second, it is described as a slightly breeze with leaf rustling. When it is 10 meter per second, it is described as a strong wind with large branches of tree moving. When it is 15 to 20 meter per second, it is called storm. When it is 25 to 30 meter per second, it is called gale. When it is 35 to 50 meter per second and above this, it is called hurricane. Air velocity, its measurements. Wind velocities are normally recorded in open, flat country at the height of 10 meter. Anemometer, the air velocity is measured by instrument called anemometer. The anemometer counts the number of rotations or turns of its semicircular cups, which is used to calculate the wind speed. The velocity of wind is indicated on a counter called cyclometer placed in the anemometer. And other instrument to measure air velocity is Carter thermometer. The Carter thermometer is heated alcohol thermometer. The time it takes to cool is measured and used to determine slight air movements. It can even record the air velocity as low as 10 feet per minute. And then comes to the recent updates. Abstract of this article: environmental concern regarding the effect of humidity and temperature on COVID-19 survival effects or fiction. The COVID-19 can survive for up to 9 days at 25 degrees centigrade. If this temperature rises to 30 degrees centigrade, its lifespan will be shorter. The COVID-19 is sensitive to humidity, and lifespan of viruses are 50%. Humidity is longer than of 30%. Also, temperature and humidity are important factors influencing the COVID-19 mortality rate and may facilitate COVID-19 transmission. Thus, considering the available and recent evidence, it seems that low temperature as well as dry and unventilated air may affect stability and transmission of COVID-19. And the other article, abstract of the article, the effect of temperature, relative humidity, and the virus infection status on or survival of the wheat curl mite. Temperature and the relative humidity significantly affected off-host survival of the wheat curl mite. Length of survival decreased with increasing temperature. 106 hours at 10 degrees centigrade and 17 hours at 30 degrees centigrade, decreasing the relative humidity. 78.1 hour at 95 and 21.3 hours at 2%. And abstract from other articles, indirect health effects of relative humidity in indoor environment. Humidity can affect the incidence of respiratory infection and allergy. Experimental studies on airborne transmitted infection, bacteria, viruses have shown that survival or infectivity of these organisms is minimized by exposure to relative humidity between 40 to 70%. The indoor size of allergic mite fungal population is directly dependent upon the relative humidity. Mite population are minimized when relative humidity is below 50% and reach a maximum size at 80% relative humidity. Most species of fungi cannot grow unless the relative humidity exceeds 60%. Relative humidity also affects the rate of off-gassing of formaldehyde from indoor building material, the rate of formation of acids and salts from the sulfur and nitrogen oxide, and the rate of formation of ozone. The influence of relative humidity on the abundance of allergens, pathogens, and noxious chemicals suggests that indoor relative humidity levels should be considered as a factor of indoor air quality. The majority of adverse health effects caused by relative humidity would be minimized by maintaining indoor level between 40 to 60%. Thus, this would require humidification during winter in areas with a cold winter climate. Humidification should be preferably used evaporative or steam humidifier, as cool mist humidifiers can disseminate aerosols contaminated with allergens. And this article, an overview on the role of the relative humidity in airborne transmission of SARS-CoV-2 in indoor environments. Humidity affects both the evaporation kinematics and particle growth. In indoor places, less humidity, less than 40% relative humidity, the chance of airborne transmission of SARS-CoV-2 are higher than that of the humid places. Greater than 90% of relative humidity. Based on earlier studies, the relative humidity of 40 to 60% was found to be optimal for the human health in indoor places. Thus, it is extremely important to set a minimum relative humidity standard for indoor environments such as hospital, offices, public transport for minimization of airborne spread of SARS-CoV-2. And then coming to MCQ session. First MCQ. On the morning of September 28, 2022, heavy wind made landfall in Cayo Costa, Florida, a Category 4 storm. Land packed 150 mph sustained wind and 10 to 15 feet of storm surge. Air velocity was over the 50. Option A, it is breeze. It is earthquake, storm, gale, and or hurricane.
Hurricane.
Yes.
E?
No, E is the right option.
Hurricane?
Yes, it's the right option. MCQs number 2. A meteorologist who studies weather has an instrument which is sensitive to slight air movement. It can measure velocities as low as 10 feet per minute. This instrument is anemometer, Asman, psychrometer, dry and wet bulb, hygrometer, wind vane, or catathermometer? Anyone?
Alpha.
No, it's E. Catathermometer.
E.
E. Yes, E.
Catathermometer.
Catathermometer, it can measure velocity as low as 10 feet per minute. MCQ number 3, the temperature to which air would have to be cooled for the saturation to occur is determined with respect to flat surface of ice. It is called dew point. B option is absolute humidity. C option is relative humidity. D option is frost point. And E option is specific humidity.
B, absolute humidity.
No, it's frost point, as I told in my presentation. MCQs 4. Experimental studies on airborne transmitted infectious bacteria and viruses have shown that survival and infectivity of these organisms are minimized by exposure to relative humidity between 20 to 50%, 30 to 70%, 40 to 70%, 40 to 90%, or 50 to 100%.
E.
It's C.
A,
No, it's C. 40 to 70%. MCQs number 5, experimental studies on fungal infection have shown that most species of fungi cannot grow unless humidity less than 40%, exceed 40%, between 40 to 60%, less than 60%, and exceed 60%.
Alpha.
No, it's E, exceed 60%. I have told in recent advances. MCQ 6, studies show humidity affects both the evaporation, kinematics, and particle growth. Thus, it is extremely important to set a minimum relative standard for indoor environment, for example, that is such as in hospitals, offices, public transport, for minimization of airborne spread of the SARS-CoV-2. So, how much relative humidity is found optimal for human health in for human health in indoor places? 20 to 60%, 20 to 70%, 30 to 70%, 40 to 60, or 40 to 90%?
D.
Yes, right answer, 40 to 60%. MCQs number 7, at 100% relative humidity, no water will evaporate from the wet bulb. The reading on the both thermometer, ordinary or wet bulb, will be maximum, the same, minimum, zero, and different.
B.
Yes, right answer is B. Both thermometer will have same reading. MCQs number 8, the labor presented in emergency department with feelings of tiredness, lethargy, high body temperature, dehydration, and fainting. The cause would be high environmental temperature, low humidity, low temperature, high humidity, low temperature. C option, low temperature, low humidity. D option is high temperature, normal humidity, and E option is high temperature and high humidity.
E.
Yes, E is the right option. An asthmatic female faced difficulty in breathing in summer due to the high humidity, used a dehumidifier for a week. The whole family faced flu-like symptoms. Also, her asthma is worsened. Cause could be A option is high absolute humidity, B is too low humidity, C is dirty humidifier, D is dry air, and E is high relative humidity.
A.
Option C is right answer. It is the dirty humidifier that can worsen the asthma or cause flu-like symptoms and RTIs in family members, all other person who are exposed. MCQs number 10. Farmer is worried about environmental condition, wants to save the field from the wheat pests. Assyria toshala is an aerophyte pest of wheat. Although its primary economic impact on wheat is due to wheat streak mosaic transmission, its survival can be reduced in environmental condition. Option A is raise in temperature and raise in humidity. B is raise in temperature, decrease in humidity. C is decrease in temperature, decrease in humidity. D is same temperature and decrease humidity. E is either rise in temperature or humidity. Anyone?
D.
No, it is.
E.
No, option is B. Here's the key of my MCQs reference of my presentation, YouTube link of our channel, and thank you.
Thank you very much. Very nice presentation. Very well done, Marina, as it is your first presentation. So this
you.
is very well delivered, well presented, and you have done a lot of good work. As far as humidity is concerned, you have also shown in your recent advances about the effect of this humidity, especially during COVID-19, how the correlation has been found between the humidity, temperature, and other environmental parameters with the COVID-19 severity. Another important thing is that the as you have said about humidity, there are certain devices that are called humidifiers. These humidifiers can help to ease problems, especially where there are dry sinuses, bloody noses, and cracked lips. So those people who have dry indoor air, their skin continuously need humidifiers to generate all those effects that are necessary for a healthy skin. So yes, there are various problems. I would like you to please add in your slide about the effects, side effects, and advantages and disadvantages of using humidifiers. You know, there is a growing market. Many people are using humidifiers in their houses as well as in their offices. But the most important thing is the dirty humidifier. Those can breed mold or bacteria, and even they can cause certain allergies, asthma, and some of the humidifiers can spread infection in the indoor settings. So I would like you to please also include two things: how the infections they can be caused by the humidifiers, and the second, what are the advantages and disadvantages of using humidifiers and its continuous use, how it can affect the human health, both the good effects as well as certain bad effects. Thank you very much. Very well done. See you
Thank you,
all
ma'am.
today.
Inshallah.
Inshallah. Allah Hafiz.
Thank you,
Allah
ma'am.
Hafiz.
Allah Hafiz.